Settling on reports that it's all ready now to pull a key part of the health care law. The assistant White House press secretary saying moments ago, not so. We do not support repeal. Repealing the Class Act isn't necessary or productive. What we should be doing is working together to address long-term care challenges we face in this country. Now, Class, of course, is a reference to a form of long-term health insurance in this new law. Reaction now from Senator John Thune, who all but predicted this. Senator, now what?
Well, I hope that we can get it repealed, Neil. The president has said he would veto a repeal of the Class Act, even though his Secretary of Health and Human Services, who's responsible for implementing it, has said it is not workable. You cannot design this in a way that makes it work. That's a conclusion that she came to, which many of us knew months and months ago when this thing actually was passed in the first place. And if they had listened to the repeated warnings from the experts in their own department, the actuary at the Health and Human Services said, this program will not work. He said that way back before they pushed it through. But this was something that they wanted a political win on, and unfortunately to the detriment of the American taxpayer. But this is one of those rare occasions here in Washington where logic actually triumphs politics, at least for now. But we need to push this thing through and get this thing repealed once and for all.
But you know what's interesting, Senator, by backtracking on this and then the administration kind of saying, well, you know, it's not that this is a waste of time. After the Health and Human Services Secretary all but said on Friday, well, I guess, be that as it may, it looks like it could have been a waste of time. This whole health care law itself, and this was a key tenet of it, it's almost up there with having people forcibly buy insurance to be part of it. This gets to call the whole law into question, does it not?
It does. It makes you wonder what other parts of the health care bill, what did they know that they're not telling us about other elements of this health care bill, because this was a massive new entitlement program that was not paid for. And you knew, and they tried to get some premium revenue in the first few years that they could use to help pay for the health care bill, knowing full well that when they got into the later years and the demands on this program started to come in, that it was going to add to the deficit. That was clearly, the Congressional Budget Office came to that conclusion, the actuary came to that conclusion. These guys, the Obama administration, repeatedly ignored the warnings that were coming out of their own administration that this will not work. And so it does draw into question other elements of this bill now. But first and foremost, what we ought to do is repeal this. Get this off the books. Don't give them an opportunity at some point in the future to try and reactivate this, because in its current incarnation, this doesn't work.
Well, the only way you can ultimately have it turned over is in the courts, maybe the Supreme Court. That could happen sometime next year. We don't know. But barring that, is it safe to say the administration, of course, has already made it clear it's going to expound on the benefits of this? A lot of your kids covered for pre-existing conditions, more people covered than before, that the benefits outweigh the minuses, and don't listen to Republicans like Thune who are telling you it's not worth the paper it's printed on. What do you say?
Well, I think that's been kind of the case all along. My view on this has been that a lot of times when they pass these new expansions of government, and the health care bill, when it's fully implemented, is a $2.5 trillion expansion, I believe that's a conservative number. And then just assuming that at some point in the future, people are going to like these programs are going to be so popular that people will be willing to pay higher taxes to keep them going. And we just can't afford that anymore. We are in a huge fiscal hole. We've got to start addressing that. We can't dig the hole deeper. And what the Class Act did was dig the hole that we're in even deeper, putting more and more debt on the backs of our children and grandchildren. And that's why, at least temporarily, this is a victory, but we've got to win the war. And there's a lot of battles yet to be fought on that front.
We'll watch it closely. Senator John Thune, good seeing you again. Thank you very much.
Thanks, Neil.